Hello and welcome back. Today's topic, we're going to dive into health and wellness because I believe that's an important topic. Of course, which vitamin should I take? As a nurse practitioner, I get asked a lot of questions like this a lot, especially as we're entering the winter months. I get asked, which vitamin? What do you think? Should I take this? Should I take that? So I felt like it was a discussion worth diving into. Which vitamin should I take? You have a right to find out and know which vitamin would be best for you. First, I want to say you do need to speak to your primary care provider, your healthcare team, and they could best lead you to the one that's best for you. However, we do want to dive into this topic because it is an important topic. And I'm pretty much going to go down a list of a few vitamins that I tend to talk to others about, even my patients, when I'm asked about vitamins. And it has helped them in their decision making as far as friends and to follow up with their own primary care, because there's so much benefit to vitamins. When you take a vitamin, a supplement, it can benefit your overall well-being. It's never to replace your nutrition status, your nutritional intake. That is not what I'm saying, but it can really be a benefit. That's why it's called a supplement. It's not to take away or for you not to consume your food, but if you can add a vitamin that is in line with what you're looking to do, absolutely. And we'll start with just going down a list. Vitamin A, there's so many benefits, and I'm not going to cover all the benefits, but just little tidbits for you, because I believe that's a topic we'll be revisiting. Vitamin A, something very relative. You can talk when you think of vitamin A for your, it can slow down for your vision. It can slow down vision loss, especially with macular degeneration. That is one of the key vitamins that I think about when I'm talking to someone and stuff. They have vision issues, especially with age-related macular degeneration. Yeah, a vitamin A would be a go-to for someone in that category. Of course, there are other benefits. Those are common supplements that may benefit you that I want to go through with you. Vitamin B12, could be another one. And B12, there's a lot of great benefits to vitamin B12. One might ask, it can help with your nerve, your blood vessels, healthy, help you in your health status, and even the prevention of anemia. There's so much for vitamin B12 that you can consume. But of course, you'd have to speak to your primary care team just to see if it's beneficial for you. But there are a lot of amazing benefits of that vitamin. You could go vitamin C, calcium. Calcium is one of those vitamins. I usually pair it with vitamin D because we're thinking about bone health. We're thinking about promote bone health for both of those vitamins. I use them in combination. I encourage the use of them in combination when I am speaking to specific patients. But again, you do need to talk to your healthcare team in regards to that. Bone health, you want to strengthen your bone. That vitamin D will, be a great supplement for you to add if that is the goal and it lines up with everything else that you're taking. Fish oil, can help support you with your heart health. If heart health is what you're working towards, a fish oil might be beneficial to add to your list of vitamins. And I've seen people with a lot of vitamins and stuff. And please I'm not saying to go out there and get all these vitamins, but just look to see what are specifics and what am I looking to work towards? What am I looking to enhance as you're taking on different vitamins? Folic acid is another good one. Of course, this vitamin has great benefits, as a lot of you know, for pregnant women and reducing birth defect. So that's a vitamin, that's folic acid. That's something to think about, especially someone that's expecting. That's something that you would consider adding to your regimen. Of course, you'll need to speak to your primary care provider. You need to speak to the the person that's following you. And lastly, I'll talk about zinc. Zinc is amazing. Promote healthy skin, slow down vision loss, yeah, from age-related macular degeneration. Zinc is a great vitamin to add, especially as the weather's changing, things are happening, and people are concerned about their health, their wellness. Yeah, adding a vitamin, adding that supplement to your regimen may be beneficial. But please do speak to your doctor. Do take care. Health is wealth, and that's why when people talk about which vitamins should I take, what would be good for me, the goal is not just to consume a lot of vitamins and not consume the things that you need to. Make sure you have a well-balanced diet, Make sure things are going accordingly as far as you eating the things that you need to eat. You getting enough nutrients, you're hydrating yourself, you're taking care of your body, you're getting enough rest. But these vitamins, just a few of them that I list, there's plenty of vitamins that you could get from online, you could get at your grocery store, wherever. But do your research. Talk to your primary care provider. Find out what is it that I need and what is it that can help me in addition to what I'm consuming, my day-to-day meals, just to enhance that. So take good care of yourself, especially as we're getting ready to go into the winter season, into the holiday season. A lot of people around, a lot of going, trying to meet deadlines and stuff. Take care of yourself. Get enough rest. Make sure you are taking your vitamins if you do have them, and just make sure it's the right one for you. Just because it's on the counter, it's at the drugstore, make sure it's beneficial for you before going forward. I hope you found this video helpful. Let's continue to grow in every aspect of our lives, and let's just continue this conversation. I love dialoguing with you. Please comment and let me know what your thoughts are, what vitamins, and if you have any suggestion, anything you'd like me to discuss, absolutely, I'd love to. So we could continue the dialogue and remain healthy as we grow day in and day out and be the very best version of ourselves. Thank you for tuning in. Stay blessed. Bye-bye.